Hello everyone, it's Ashley, your favorite VJ for ICD-10 coding. This week we're going to talk about some helpful hints for Chapter 21, Diseases of the Genitourinary System. This chapter discusses some commonly coded conditions and procedures such as urinary tract infections, chronic kidney disease, prostate conditions, urinary calculus or a stone, calculi, stones, dialysis procedures, and we will briefly touch base on some hysterectomy procedure terms also. Let's jump right into some examples to code together. In exercise 21.1, you will look at the diagnosis of chronic cystitis due to Manila infection. When you're coding UTIs or urinary tract infections, such as cystitis or urethritis, you should first look for the specific condition. So in this case, the specific condition is cystitis, inflammation of the urinary bladder. Look for that condition in the alphabetic index before finding the main term for the type of infection. So we'll begin with the main term of cystitis with the subterm chronic, and you will find that none of these subterms pertain to our documentation, so we will go directly to this N30.20 in the tabular list. So here we go. And you will note the instructional note, use additional code to identify infectious agent. So now we will go to infection in the alphabetic index. So up here, remember, we're in the tabular list. Down here, we're back in the alphabetic index. So when we go to infection subterm Manila, it tells us to see candidiasis. So here we are still in the alphabetic index. We're going to go check out candidiasis. When we get there, we see that there's actually a subterm for cystitis, B37.41. In this case, this code includes not only the infectious type, candidiasis, right, but also the condition itself, the cystitis. So this combination code is all we're really going to need at the end, this B37.41. The N30.20, we don't need to pull in that code because we've already pulled in, again, the infection type and the condition here in one combination code. So the B37.41 will be the final code. On another note, let's talk about chronic kidney disease. It's important to understand that ICD-10-CM always presumes a cause and effect relationship between chronic kidney disease and hypertension. Now, how do we know this outside of the textbook telling us? In a past few videos, we have touched base and found some chapter-specific guidelines in the front of the book. So this is another one of those occasions where we will be referring to the guidelines for, of course, guidance. So let's go ahead and take a look at these chapter-specific guidelines for the genitourinary system, again, in the front of your CM code book. And here you will find little nuggets of wisdom, such as when discussing the stages of chronic kidney disease. Here, let's say a physician documents the chronic kidney disease as moderate. Well, our only option in the alphabetic index may be stage 3. So here it's telling you stage 3, code N18.3, equates to moderate chronic kidney disease. And stage 4 equates to severe chronic kidney disease. So again, if you're ever stuck in a coding situation, just have that be your first instinct to go check the guidelines for a little extra help. Usually that will solve all of your problems. Now getting back to this chronic kidney disease and hypertension link, down here, still in the genitourinary chapter specific guidelines, chronic kidney disease with other conditions. And down here, we see a little reference note, CIC9, hypertensive chronic kidney disease. And this is leading us to another reference in the guidelines. So now, when we go to IC9, which means it's chapter 9, diseases of the circulatory system, hypertensive chronic kidney disease, this has a nice little phrase here. Unlike hypertension with heart disease, ICD-10-CM presumes a cause and effect relationship and classifies chronic kidney disease with hypertension as hypertensive chronic kidney disease. So here they're telling us, unlike hypertension with heart disease, so there's no cause and effect relationship that is presumed between hypertension and heart disease, but it is presumed that there is a cause and effect relationship between chronic kidney disease and hypertension. So just little things like this, again, be on the lookout in your chapter-specific guidelines. Let's go ahead and look at a chronic kidney disease example from exercise 21.2. Here we find chronic kidney disease, stage 5, requiring chronic dialysis. So this is our diagnosis. And then here we have a procedure statement. Catheter insertion into superior vena cava via the left subclavian vein for renal dialysis. Single hemodialysis performed. So let's go ahead and just begin with this first part, the actual diagnosis statement. So here we will begin with the main term of disease with the subterm kidney. Next subterm chronic, and it tells us it's stage 5. So N18.5, so we know we always need to act, always check the tabular. So when we get over here to N18.5 in the tabular list, chronic kidney disease stage 5. Here we find an excludes one note. So again, emphasizing that importance of always checking the tabular list. So excludes 1, as you remember, and if you don't remember, please check in the front of your book in those coding conventions. Excludes 1 means not coded here. So chronic kidney disease stage 5, which is what we have, but if it's requiring chronic dialysis, which is definitely documented up here, then it cannot be coded as N18.5, and it tells us instead to code to N18.6, end-stage renal disease. And then you'll also see a little helpful note here, chronic kidney disease requiring chronic dialysis. So, again, we're not being led to the exact right place from the alphabetic index. Again, checking that tabular list. So the final 2 diagnosis codes here will be the N18.6, and then we have another note here at N18.6, use additional code to identify dialysis status. Because we have that chronic dialysis, we need to pull in a Z code. Z99.2 to document that dialysis status. So let's go ahead and take a look at these procedural statements. We kind of have 2 things going on here. First, we have catheter insertion into superior vena cava via the left subclavian vein for renal dialysis. So we need to code the insertion of that catheter. We know it's going into the superior vena cava, but what do we do with this phrase, via the subclavian vein? When you are coding for an insertion, especially of a catheter in PCS, please note that you want to code to the furthest point of the insertion. So here they're telling us they are inserting the catheter into the superior vena cava via the subclavian vein. So they're entering here and tunneling down into the superior vena cava. Because this is the furthest point of insertion, that's where we code. So we'll be following this path in the alphabetic index of PCS, insertion of device in vena cava, not the left subclavian vein. Code to that furthest point of insertion. So here we have insertion of device in vena cava superior, 02 HV. That will lead us to this table with superior vena cava. Then working across the table, we will choose character 3 here for percutaneous, right? We're inserting through the skin and no mention of a scope. We will pull in character 3 for the device, infusion device. So a catheter is an infusion device. So we'll pull in character 3 there, and then no qualifier, Z. So our final code for this particular portion of the statement will be 02 HV 33Z. So this is just for the catheter insertion only. Then you would need to go on and code for the hemodialysis, and we just do that by looking up the term hemodialysis in the alphabetic index, and it's pretty straightforward from there. So I'm sure that you can figure that out, but that final hemodialysis code is 5A, sorry, it's hard to write on these screens, 5A 1D 00Z. So we end up with the 2 diagnosis codes, remembering to pull in the chronic dialysis Z code, and then we end up with 2 procedure codes up here. Now let's move along and compare 2 surgical techniques which address stones in the urinary tract. Both of these examples that we are going to compare and contrast here are from exercise 21.3. So first of all, we have extracorporeal shockwave lithotripsy of left kidney calculus. And the second example, lithotripsy of urinary bladder with ultrasonic fragmentation and removal of fragments via percutaneous endoscopic approach. So this is a lithotripsy procedure and this is a lithotripsy procedure, but we are actually going to code each of these exercises to a different root operation. So let's talk about this. First of all, what is a lithotripsy procedure? Again, thinking back to medical terminology, we're always applying that course when we're coding. So remember that tripsy means to crush, and we know litho, we've had a few times this semester, means stone or calculus. So lithotripsy procedure means to crush a stone. So we have that going on in both examples here. Now, in example number 1 here, they do not mention removing the fragments. When they send in those shock waves, they're breaking up the stone into little fragments, but they don't mention removing the fragments after they're crushing them up. So here in this example, they're actually leaving those crushed fragments in the body to pass on their own naturally through a natural process, through urination. So here we will code to the root operation of fragmentation, meaning the only procedure that's being done is the lithotripsy. They're breaking up the stone into little pieces, fragments. However, in exercise 2, yes, they're performing the lithotripsy, so they're crushing the stone into little fragments, but they're also removing the fragments via percutaneous endoscopic approach. So when a lithotripsy procedure also removes the fragments surgically, so they're not left to pass naturally like we had over here, they're actually being removed surgically, then we will code to the root operation of extirpation. So remember what extirpation means. It means removing solid matter from a body part, okay? So in the past, we've seen extirpation exercises where we're removing a foreign body, such as, say, a fish bone. You're removing solid matter that's not supposed to be there from the body, extirpation. But when you go back and look closely in the the appendix, at that definition of extirpation, there's another supplemental explanation there. And it also mentions that solid matter may of course be a foreign body, such as a fish bone, but also solid matter could be considered an abnormal byproduct of a biological function. And that's what the calculus or stone is. It's an abnormal byproduct of the body's biological function. So that's why we're coding removing the fragments to extirpation. Now, the alphabetic index gives you a little guidance here, which is nice, but I want you to have a handle on why you're given this choice in the alphabetic index. So when you look up lithotripsy as the procedure, it does a nice job of directing you. With removal of fragments, see extirpation, and now we know why. We have this byproduct of a natural body process that we need to take out. But if we're not removing, then we will code to fragmentation over here. So at the end of the day, for exercise number 1, we're going to have the root operation fragmentation of the left kidney calculus. The approach, X, is going to be X for external. How do we know this is an external approach here? Extracorporeal. Again, medical terminology. Pertaining to, extra meaning outside, corpo meaning body, pertaining to outside the body. So again, we're sending those shock waves in from the outside. So external approach, no device, no qualifier. Then exercise number 2 would be coded to extirpation of the bladder. It tells us it's percutaneous endoscopic approach, so that's going to be the character 5, the percutaneous endo. They were using a scope, and then no device, no qualifier. One last item I'd like to review this week is related to hysterectomy procedures. It's important to understand the difference in medical documentation. So if you see a hysterectomy documented as supracervical, again, medical documentation pertaining to above the cervix. So supracervical or subtotal or partial. So any of these words given in relation to a hysterectomy procedure means that only the upper part or the uterus is going to be removed. The cervix will be kept in place. On the other hand, if a hysterectomy is documented as total or complete, then both the uterus and the cervix are going to be removed. Now, usually this semester, right, we've been conditioned to think that when we see this term partial, oh, that's a big red flag that tells me I'm going to be coding for an excision, right, a portion of a body part. However, for hysterectomies, this is why I want to draw your attention to this week. Partial means you're removing all of the uterus, so we're still coding to a resection. it's just telling you we're leaving the cervix in place. So in both of these instances, supracervical and total, both will be coded to a resection. Taking a look at the index, the alphabetic index, and then the PCS table for hysterectomy, this is going to prove to us the importance of always using the most recent version of a code book. Prior to 2018, a total hysterectomy needed to have 2 codes. So in the past, when we saw a total hysterectomy documented, we needed to have resection of the uterus, but it would also tell us here in the alphabetic index to see resection cervix also. But this is a big change for 2018. Now we have this option for supracervical, and as you can see, it's sending us to the same table for both. So this is nice. So now for a total hysterectomy, we only need 1 resection code because they've added a qualifier option. In the past, it was 2 codes. So this is nice in 2018. It's simplified down to 1 code for us. So once we go and check the table here, it's telling us to see table 0 UT for each of these options. So here we are, the body part, we're going to stick with the uterus, right? So hysterectomy, surgical removal of the uterus. You would pick the appropriate approach, no device, so we're always going to have a Z for the 6th character. But it's nice now we have this qualifier. So again, if the hysterectomy is documented as supracervical or partial or subtotal, then we know the cervix is not also being removed, so we would give it the qualifier of L. And if it was a total resection where they are including the cervix, we're actually going to stick with Z, no qualifier, meaning they're taking out the uterus and the cervix all together. You would not have to pull in another code for cervix. 1 code is fine here. As usual, thanks for taking the time to view the video. Happy coding. See you next time. And also don't forget to post to that coding roundtable if you have any exercise questions.